Assalamu alaikum. In the last few episodes, we talked about large, medium, and small vessel vasculitis affecting the skin. Today, we'll briefly discuss single organ vasculitis of the skin. In these types of vasculitis affects cutaneous vessels of any size without evidence of being part of a systemic vasculitis or evidence of being a limited expression of systemic vasculitis. Single organ vasculitis of the skin includes cutaneous IgM-IgG immune complex vasculitis, nodular cutaneous vasculitis, normocomplementemic urticarial vasculitis, and erythema elevatum diutinum. In addition, it may also include recurrent macular vasculitis in hypergammaglobulinemia, which is also known as hypergammaglobulinemic purpura of Waldenström. In the first type, IgM-IgG vasculitis, it's a leukocytoclastic vasculitis of post-capillary venules. Clinically, it is not distinguishable from IgA vasculitis or Hennock's line purpura. However, it is more limited to the lower legs, may show livido, and the purpura of IgM-IgG vasculitis is less palpable and more unpalpable in comparison to Hennock's line purpura. Immunofluorescence showing perivascular IgG or IgM deposits can be sometimes helpful to distinguish this disease from Hennock's line purpura. Erythema elevatum diutinum is a rare neutrophilic dermatosis with a fibrosing leukocytoclastic vasculitis and IgA deposits. Erythema elevatum diutinum has been reported with other non-vasculitic diseases, including monoclonal gammopathy, particularly of the IgA type, also reported with various autoimmune diseases and infections. Erythema elevatum diutinum presents with reddish to brown yellow papules, nodules, and plaques that are symmetrically distributed over the extensor surfaces of the hands and knees. Interestingly, the lesions become higher and harder at night time and upon exposure to cold. This phenomena is probably related to decrease in body temperature, which stimulates cutaneous vessels vasoconstriction, leading to a sluggish circulation and higher rate of immunoglobulin deposition. Nodular vasculitis is a lobular panniculitis and vasculitis affecting small to medium vessels of the skin, which can be associated with necrosis and granuloma formation. In presence of TB, nodular vasculitis is known as erythema induratum of Basin, which is a hypersensitivity reaction to mycobacterial antigens. Nodular vasculitis is classified into three types: either TB associated or associated with other diseases or drugs like hepatitis, Crohn's disease, or the use of TNF inhibitors. And finally, it can be just an idiopathic form of single organ vasculitis. Clinically, the lesions present with recurrent violaceous nodules with a tendency to ulceration. However, the spectrum may range from subcutaneous induration to well-defined plaques affecting the posterior or lateral aspects of the lower legs. We have already discussed normocomplementemic urticarial vasculitis in part 3 of this series, so we will go directly to brief you about hypergammaglobulinemic purpura of Waldenström, which is more often than not secondary to an underlying autoimmune disease. However, rare idiopathic cases have been reported, and this makes it a candidate to be included under single organ vasculitis of the skin, as the primary type presents with only skin affection in the form of recurrent purpura of the lower extremities. The disease is quite rare. It affects females between the age of 18 to 40 years, and we can see immunoglobulin deposits associated with hypergammaglobulinemia. Purpura, elevated ESR, mild anemia, and circulating immune complexes are usually present in patients with this type of vasculitis. There is the primary type, as we discussed, and the secondary type, which may be secondary to Sjogren or lupus erythematosus.